Now to the H1N1 virus as the vaccine begins to arrive in West Michigan.
Right now, that vaccine is only being distributed to health professionals, so those who help others during this flu season can stay healthy themselves. The vaccine is expected to become available to the general public later this month or early next month, with priority being given to children and young adults, caregivers of small children as well. And as that vaccine becomes available, health officials are hoping broadcast ads and billboards will convince more people to get the immunization.
They say it's critical because a third of parents across the country are saying no.
24-hour News 8's Henry Erb is looking into that part of the story tonight. Henry?
Yeah, some of it appears to be fear, according to national polls, but there is other thinking going on about the flu and what to do about it.
For the Fender family, the decision to not get H1N1 shots appears to be a philosophical one. The kids are homeschooled and don't get any vaccinations.
And honestly, I don't see any value of vaccines any more than I would making sure they're healthy and safe and have a good, clean upbringing.
For them, prevention is better. They school the children on a proper diet, hand washing, and how to take care of themselves.
I think a lot of it has to do with education about cleanliness and taking care of ourselves. And when you are contagious, you stay home and you don't infect other people. So we just become smarter as a society in order to take care of ourselves.
Well, normal flu kills more people worldwide than the swine flu has ever killed.
And in fact, the similarity between the flus has left some people unconcerned. One study here in Michigan found that half the parents did not consider H1N1 any worse than the usual seasonal bug. Health officials tend to agree.
Individuals that become ill with H1N1 have symptoms very similar to seasonal flu. Fever, cough, runny nose, body aches.
But health officials such as Bill Anstey say trusting to good hygiene practices and being careful may not be enough because, for one thing, you could have H1N1 for a day without knowing it, all the while infecting others with it. And health officials worry that mild symptoms now could become worse later.
The flu virus can change during the course of a flu season and symptoms can become more severe. That's what we're trying to guard against.
According to the Associated Press poll, 72% of those surveyed worry about possible side effects, although more than half say that won't stop them from getting their kids vaccinated. Health officials say the H1N1 vaccine is produced the same way regular flu vaccine is made, and that is shown to be safe by years of use. Some remember claims made in 1976 that the swine flu vaccine then caused some illness, but health officials say there was never any evidence that it did.
Yeah, Guillain-Barré, and there were about 3 dozen people, almost maybe 30-some people, who died, and they thought that was connected. Okay, Henry, thank you for that.
Henry.
We've collected a number of resources for you and your family, including which clinics have already been scheduled, information on the study of parents Henry Erb just referenced in his story, and 10 things you need to know about the virus. You can find all of that on our website. Just go to woodtv.com.
Now to the battle over the